The functions of the urinary system is not just as simple as making urine and getting rid of it. I mean, that is the primary function. It's the removal of metabolic waste. That's really what urine contains. Solid waste, of course, would be in the fecal matter, which is part of the digestive system in terms of getting rid of it. But here is all about filtering blood and getting rid of metabolic waste out of your bodily fluids. In addition to that, you have the regulation of blood volume and blood pressure. Your kidneys actually secrete hormones in response to how much blood is flowing through them, the pressure, either the lack of fluid or too much fluid, and that has an effect on your blood pressure and blood volume. It also regulates plasma concentrations of various electrolytes, various minerals like sodium, potassium, chloride, etc., because it's going to get rid of more of those or less of those through urine, depending on how much you have. And it also helps to stabilize blood pH. In addition to getting rid of stuff like sodium or hanging on to it, hanging on to H+, or getting rid of H+, these hydrogen ions, that has an effect on pH. In addition, bicarbonate ions, which has an effect on the alkaline levels. So if you know enough about pH, hanging on to this would actually make the blood slightly more acidic. Getting rid of this would actually make the blood slightly more basic. And the normal pH for blood in the human body is 7.4 on the pH scale. That's slightly basic. It also conserves valuable nutrients. You want to hang on to certain things in your bloodstream and not get rid of them, and that comes down to kidney function. So when we look at the different organs and tissues of the urinary system, there are four main players. Here's a little drawing of it. You've got the kidneys, of course. They look like kidney beans. This is the left kidney. This is the right kidney. The left kidney is ever so slightly higher. The right kidney is a little bit lower because of the liver kind of hanging down over it. So, it's normal to be born with two kidneys. There are the ureters, which are these tubes that take recently made urine out of the kidneys to a temporary storage spot known as the urinary bladder. Just calling it the bladder is not sufficient in anatomy because there's also the gallbladder. So you want to specify that this is the urinary bladder. And then the urethra. The urethra is that tube that finally takes urine out of the body. And it is, of course, longer in males, shorter in females. I'll discuss that more later. All right, so when we look at kidneys, these amazing organs that actually make urine, you do have two kidneys on either side of the spine between the thoracic vertebrae at the bottom of the thoracic curvature, so number 12, where your last ribs are found, and down to about the third lumbar vertebra, which means that they're only partially covered by your rib cage. Just the top portion has some ribs going just posterior to it. And your kidneys actually are very much a posterior organ. There's this term kidney shot. If someone, hits you right back there, right under the rib cage, and that kind of impact could definitely damage kidneys. It happens in contact sports often. But the left kidney is slightly superior, slightly higher to the right one. They are held in place by surrounding connective tissue, and that surrounding connective tissue includes the peritoneum, and it's a nice wrapping around abdominal organs that keeps them in place. And there's other neighboring organs that help keep them in place. They're reddish brown, the reddishness, of course, because of the high blood flow. There's a lot of blood going to your kidneys every second of the day. They're about 10 centimeters long, 5.5 centimeters wide, and about 3 centimeters thick, with a mass of about 150 grams each. So here are the major parts. Let's label these. So the renal cortex, Renal cortex, you see that right here. As with the adrenal glands or any other organ that has the term cortex, that means the superficial outer part of it. So the renal cortex, you're going to see a lot going on in the next few slides in terms of how the filtration process gets started. The renal medulla, or medulla, some people pronounce it that way, that's a bit deeper, just like with the adrenal medulla. So you can see that these little areas that kind of look triangular, that's really where most of the medulla is going on. And those are called renal pyramids because they do look pyramidal, triangular. So here's a renal pyramid, renal pyramid, renal pyramid. So those make up most of that medullary layer in the kidneys. And this is, of course, a cross-section, a frontal section or coronal section through a kidney. From the outside, you would not see the pyramids and, you know, seeing that medulla, so you'd have to cut into it to see them. And then you have these two areas. They're each calyces or calyxes, major and minor. So once you have development of urine, it comes out of the medullary area into what are called minor calyxes, and all of the minor calyxes lead to major calyxes. These are the major calyxes here, and then it goes into what's called the renal pelvis. So the renal pelvis, let me use yellow for the calyxes. And here, these are the calyxes. And then the renal pelvis is this collecting area right in here. And this other term, the hilum, is kind of that exit region of the kidney through which the renal pelvis empties into the ureters. So renal pelvis is actually at the medial side of the kidneys because the kidneys kind of point towards each other, and the renal pelvises feed into the ureters, which of course then go into the bladder.